the head of the fibula, stomach 36, manual treatment. Hi, konnichiwa, I'm Oleksiy the therapist, and today I'm treating right knee pain using acupuncture. Eventually, needles will be placed in both legs to increase the therapeutic effect. Probing the needle insertion place with alcohol. Opening the needles. First I will do stomach 35 and XL2. Stomach 35, which is lateral, and XL2, which is medial, right under the patella, line of the knee joint, and it's called eyes of the knee, or in Chinese medicine, cow's nose. If we press here, it looks like nostrils and the nose of a cow. Inserting the needle in stomach 35. And XL2. Next point will be stomach 36, which is 3 tune below the stomach 35. And the next point on the medial side will be spleen 9, which is inferior to the tibial condyle and posterior to the tibial medial ridge. The next point is gallbladder 34, which is anterior and inferior from the head of the fibula. And the last point, stomach 38, which is 5 tune below stomach 36, or right in the middle between the ankle joint and the knee joint, 1 tune from anterior tibial border. To memorize the points better, I will go over again and mark them accordingly. Stomach 35, XL2, stomach 36, gallbladder 34, spleen 9, and stomach 38. And once again, eyes of the knee, cow's nose, stomach 35, XL2, stomach 36, gallbladder 34, spleen 9, and stomach 38. Sharp needle container, which I'm going to use for needles after taking them out. Already a lot of needles are in there, so needs to be replaced. After 20 minutes of treatment, I am taking the needles out. Checking for any possible bleeding, all clean. After acupuncture part of the treatment is done, manual treatment can be added and will be added to today's session.